Mr. Speaker, I rise today in support of H.R. 6 and the foster youth who will benefit from its passage. One of the most popular provisions of the Affordable Care Act allows young adults to stay on their parents' health insurance until they turn 26. It's only fair that young adults who age out of foster care should keep their coverage until they turn 26 too. But when the ACA was implemented, the Department of Health and Human Services gave states the option of covering young adults who aged out of foster care in a different state. For example, if a young adult aged out of the system at 18 and had coverage in California, but then moved to New York would have the option to cover them under Medicaid until they turned 26 or not. This extended coverage was never supposed to be optional. After all, former foster youth should have every opportunity to move freely without the fear of losing the life-saving health insurance. That's why I introduced the Health Insurance for Former Foster Youth Act. Last month, over 100 former foster youth were on the Hill and shadowed their members of Congress. We celebrated that many of the young adults had been accepted to college, some out of state. This bill will ensure that when former foster youth age out of the system, that they can keep their health care coverage until 26, no matter where they live. This is about fairness. Former foster youth should be treated the same way as we treat all young people. I'm grateful to my colleagues on both sides of the aisle for including my bill in this bipartisan opioid package. Just this week, The Hill reported that states hardest hit by the opioid epidemic have seen the number of children in foster care or state care increase dramatically. Again, I thank my colleagues for working with me to clarify this law, and I thank Chairman Walden and Ranking Member Pallone for your leadership on this issue. I yield the remainder of my time.